Good morning, everybody. My name is Dr. Kate Yoon. I'm a pediatrician at the Children's Hospital of Philadelphia's Refugee Health Program. Thank you for joining us for talking about stress, emotional support for you and your communities during the pandemic. This brief recorded presentation will be followed by a live question and answer period. Next slide, please. This presentation was prepared by a team from different disciplines and different areas of expertise, including mental health first aid, medical interpreting, clinical psychology, community health, social work, public health, and community service. Our goal is to further empower you as refugee community leaders in supporting your communities during the pandemic. We hope that this presentation will increase awareness of resources available to deal with stress. We also hope it will normalize help seeking when people are feeling stressed, sad, anxious, or overwhelmed. Next slide, please.
Hi, everyone. My name is Ashok Guru. So today we are, now I will start with everyone experiences stressful events. I'm a former refugee from Bhutan and I live in Pittsburgh. I am a mental health first aid trainer and I also work for a policy lab at Children's Hospital of Philadelphia. Difficult and stressful events are common in life. Torture in home country, fleeing from home, in some cases, leaving family members and becoming a refugee are all traumatic events. Most refugees hope that after resettlement, life will be predictable and safe. Unfortunately, for many people, the pandemic has become a new source of stress and even trauma. For example, many of us today probably have a friend who overcome multiple challenges before coming to the United States as a refugee. Maybe this friend has lost a parent before fleeing their home country. Maybe once they arrived in the United States, they were stressed or they were stressed out by needing to learn English quickly and get a job. Maybe a friend was worried all the time, even before the pandemic, but now they are worrying even more, having trouble sleeping, getting angry all the time with their children, struggling with the uncertainty around when they will be able to gather with their community members again, as well as whether they will lose their job or whether their loved ones are safe in their workplace with the COVID. Next slide, please. So with time, people can recover. In other words, the pandemic has made it even harder for many refugees to recover from stress of prior traumatic events. And the pandemic has made it harder for many refugees to seek treatment for several severe stress and problems that can arise from it. Like substance abuse disorder or anxiety. However, the human capacity to healing is still a source of hope. Our communities have overcome many challenges, and we know that we can overcome from this as well. So going to the next slide, caring for heart. So I'm just giving it to Dr. Linda McCotter from here, and I'll come back later.
Thank you, Mr. Gurung. I'm Dr. Linda McCotter, and I am a clinical psychologist at Widener University. And just as Mr. Gurung explained, stressful events can lead to conditions like PTSD, post-traumatic stress disorder, and especially when there is like severe or prolonged reactions to traumatic events. PTSD can not just affect us, but everyone around us. For this reason, caring for the heart, soul, and spirit is extremely important. Fortunately, there are effective treatments for PTSD that promote healing of the heart and spirit. So let's imagine that friend again. Who are they going to reach out to for help with their worries and stress? Who are they going to talk to if they think they need to see a doctor to help manage their sadness or their stress? We know that it's probably going to be someone they already trust. Maybe it will be you. Your work helping others to seek care, including mental health care, is an incredible gift for your friends and your community. For the rest of the meeting today, we're going to review resources, strategies, and information to support you in everything you already do for your community. We want to emphasize that supporting people in accessing mental health and mental health care begins with our everyday lives, even before you know that someone is experiencing stress. This is because each of us plays a role in decreasing mental health stigma. Decreasing stigma includes educating ourselves about mental health problems, educating others about mental health problems, and being supportive of family members and friends who are struggling. Talking about mental health problems respectfully is extremely important, as is talking about mental health treatment routinely and respectfully. It is also important to know that friends who are overwhelmed by worries or sadness are not crazy or weak. Mental health problems are common and are treatable. Seeking mental health care is a normal thing to do. And just like diabetes or other common health problems, mental health problems get better with time, support, and treatment. Mr. Gurung will now talk about some ways you can educate yourself about mental health.
Thank you, Dr. Mikoder. So helping others, mental health first aid. So if you haven't received any mental health education, one place to learn more is mental health first aid training. It is a one-day course. It used to be 8 hours in person before the pandemic, but pandemic has changed everything, as well as we all know. So currently, it's virtual that goes from 6 to 7.5 hours. This includes 2 hours of self-paced online course done by the participants, and then it ranges from 4 to 4.5 to 5 hours virtual classroom with the instructor. The training prepares participants to be better support people with mental health problems. You learn about common mental health problems such as depression, anxiety, trauma, PTSD, psychosis, and substance use disorder. You'll also learn about recovery and resilience. We look at the person's strength, not just their problems. The training also helps reduce stigma by increasing mental health knowledge, describing the correlation between physical and mental health, and preparing us to help our peers. Mental health first aid training teaches the mental illness are real, treatable illness from which people can recover. Going to the next slide. So mental health first aid action plan. So there are 3 types of mental health first aid training. Initially, it used to be adult mental health first aid training, then came youth training, and now teen training. The teen training is for adolescents themselves. All 3 types of mental health training teaches how to assess risk, listen, reassure, and encourage people to take steps to help themselves and get professional help when needed. So mental health first aid uses something called the LG action plan. So this is what we use for helping our friends or peers who are in a crisis situation. So they have LG as an acronym. So A stands for assess. So assessment is a central piece of for determining if anybody is in crisis. We need to call a crisis line if we find somebody is at risk of hurting themselves or hurting anyone. The L stands for listen non-judgmentally. We often tend to judge someone by their problems rather than judging them by their who they are. But people are not defined by their problems. They are actually human first. We need to learn to listen without judging. And the G stands for give reassurance and information. We need to know how to share information in a way that is supportive and reassuring. We need to know about the local resources for mental health care and other support. Likewise, we have E that stands for encourage encourage appropriate professional help. We need to know who to encourage, how to encourage people to seek professional help for mental health problems. Like we know that there are different ways how it can be helped, but mostly the professional people would be the one to take care of them. Likewise, the last E stands for encourage self-help and other supportive strategies. We tend to know how to encourage, we need to know how to encourage people to engage in self-help and self-care. So all these different strategies or techniques are learned in mental health first aid training. Here is how we find training near you. So we can go to mentalhealthfirstaid.org, or we can simply Google mental health first aid, then you can select the take a course. From there, you have to put your zip code. Once you put a zip code, then you'll see upcoming training in your area. The website has phone numbers for groups that organize the training, and you can contact them directly. You can also organize a training. If you have interested participants, you could reach out to me in Pennsylvania. My name is Ashok Guru, or in other states as well. If you need to, if I can't do the training myself, I can help coordinate with the concerned parties. I can do the training in Nepali as well as in English if that helps for your community, and I'll try to manage it. If you have a nonprofit organization, you may also be able to organize training for your staff and volunteers for free of cost or low cost through the local organization's support. For example, in Erie, Pennsylvania, there is a nonprofit called National Alliance on Mental Health, or they go by NAMI in short, that will organize a free training. So likewise in Pittsburgh, Pennsylvania, we have Allegheny Health Choice or Department of Human Services as well, who help us in organizing the training. Going to the next slide, so we have helping others, crisis helplines. So despite the best effort, a friend or a community member may still wait until they are in crisis before asking for help. By this, we mean they feel desperate and completely overwhelmed, and they are having thoughts of suicide. It is important for everyone in the community to be aware of the crisis numbers, and the people who they can call when this happens. So every county in Pennsylvania has mental health crisis hotline numbers, as well as we see. We will share. We'll share a link of those numbers in the final slide, so you can see different, different organizations with supports available. So Resolve Crisis is a local one, for an example, that I have used in Pittsburgh. There are also national crisis line, example, National Suicide Prevention Lifeline. If someone is struggling, give them the numbers and they can call, or you can help them call. They answer calls 24/7, 365 days throughout the year. Once you tell them the language you need, you will be connected with an interpreter after the short wait. So some people may not have any language to speak, but they can at least say in language and interpreter. For example, if I say Nepali interpreter, you can also look through SAMHSA's website for more resources. You can visit samhsa.gov and then go to find treatment. Now back to Dr. McWhorter.
Thank you, Mr. Gurung. When you have a friend who is suffering, I encourage you to talk about suicide and to take all talk about suicide seriously. If you are concerned that a person might harm themselves or someone else right away, please call 911 or take them to an emergency room. There are posters about suicide prevention and the National Suicide Prevention Lifeline in many languages. You can post these on your website or provide them to community members. Hopefully, your friend will talk with you before they are in a crisis, giving you an opportunity to connect your friend with mental health treatment. But if your friend is not comfortable seeking formal treatment from a doctor or a mental health specialist, a warm-up might be needed. You can encourage your friend to talk to other trusted friends, family members, faith leaders, or community leaders about their symptoms and their experiences. Encourage self-help strategies that are already familiar with in your community, such as meditation, exercise, yoga, or prayer, and fellowship with friends and family. Remind them that getting treatment for stress, including more severe forms of stress like PTSD, is just like getting treatment for other chronic health problems like diabetes, in that treatment is effective, available, and prevents bigger problems in the future. You can also help by explaining the different ways in which people may receive mental health care. There are different kinds of treatment providers and different kinds of treatments that do work. Some types of treatment focus on getting help for practical problems that are making life difficult, like joining a community group or a class to deal with loneliness. Some types of treatment called psychotherapy include talking to a mental health specialist on a regular basis, like once or twice a week for 3 to 6 months. The mental health specialist will listen in a supportive way and help you learn and practice skills to manage stress and make traumatic memories less painful. The mental health specialist may be a psychologist, a counselor, or a clinical social worker. Another type of treatment includes daily medication that might be prescribed by a primary care physician or a physician who specializes in the treatment of mental health, called a psychiatrist. You can also help by explaining the pathway through which people may receive mental health care and set realistic expectations, because this process usually takes many weeks. Seeking treatment almost always starts with a telephone call. Sometimes this call will be to your friend's primary care provider to seek their advice, or your friend may want to go directly to a mental health specialist. In this case, your friend would call a mental health clinic to schedule an intake appointment or to find out if the clinic has walk-in intake hours. During intake, a mental health specialist will ask many questions and find out more about your friend's problems and strengths. This person might then continue to see your friend for treatment, or your friend may be assigned to a new mental health specialist for treatment. Sometimes there is a wait of a few days or a few weeks between the intake appointment and the first appointment for treatment. Once treatment starts, most psychotherapy for PTSD and other stress-related problems requires 12 to 24 weekly appointments. If your friend is also prescribed medication, they should know that it may take 2 to 6 weeks for the medication to start to work. Your friend should take the medication exactly as recommended and should tell their doctor before making any changes or stopping the medication. In every county in Pennsylvania, mental health care is available at no or minimum cost for children and adults with Medicaid and other public health insurance. Each county in Pennsylvania also has a single phone number that can be used to identify outpatient mental health treatment for patients enrolled in Medicaid. And we will include information about where to find those phone numbers at the end of this talk. In Philadelphia, for example, you could call Community Behavioral Health Member Services to obtain information about different psychologists and psychiatrists who accept Medicaid. In Philadelphia, you should also contact the Community Behavioral Health Member Services to request an interpreter for a phone call or an appointment with mental health providers for Medicaid patients. And now Priscilla Ortiz will talk more about working with professional interpreters.
Thank you, Dr. McWhorter. My name is Priscilla Ortiz. I'm an applied linguist and a certified medical interpreter for Spanish. I work with the Interpreting and Translation Services at Children's Hospital of Philadelphia. We know that language is often a barrier. You can support your friend by encouraging them to request an interpreter when they call to seek mental health treatment. They can say their language and the word interpreter. For example, Nepali interpreter. People have the right for interpreters to healthcare at no cost to them, including healthcare for PTSD. This is a federal law. Interpreters are available by phone or video or in person. Usually, interpreters are scheduled through your healthcare provider. For example, as Dr. McWhorter mentioned, in Philadelphia, you should contact Community Behavioral Health Member Services to request an interpreter for a phone call or appointment with a mental health care provider for Medicaid patients. Healthcare providers that do not have easy access to interpreters, such as some pharmacies, can also ask to participate in a language access program developed by the Pennsylvania Refugee Health Program to ensure that refugees who have arrived in the US in the past 2 years have access to interpreters when seeking help for mental health needs. Interpreters are a part of your healthcare team. They're trained to interpret exactly what you and the doctors are saying without adding any of their own ideas. HIPAA, which is the federal policy for privacy in healthcare, requires that medical staff, doctors, interpreters, and everyone related to your healthcare keep your personal information completely private unless you give them permission in writing to share that with a specific person or organization. Next slide. And if you are working as an interpreter, do your best to use language that will decrease stigma and help people feel comfortable with mental health care. One tool that might help are a set of glossaries that we created to help you talk about mental health. We worked with translators and community members to find words to reduce the stigma and other inaccurate assumptions about mental health. You can find these glossaries on the Policy Lab website. Now back to Dr. McWhorter.
As leaders, supporting your community takes a lot of your time and energy. To have that energy to give, it's important to take care of yourself. Stress and emotional problems affect your immune system and make it easier to get sick. These problems affect your sleep, appetite, concentration, and your relationships. So to protect yourself, your family, and your community, here are some healthy habits. Get enough sleep. Stay connected to people you care about through video chat, telephone calls, and texting. Find ways to relax and renew yourself, such as meditation, yoga, prayer, or walks. Gardening, or talking with supportive community members and family members. And be sure that you're eating regular meals and drinking plenty of water. Now, Dr. Patty Stubber will share information about where to find key resources.
Hello, everyone. My name is Patty Stubber, and I'm with the Multicultural Health Evaluation Delivery System, better known as MEDS, in Erie, Pennsylvania. MEDS is part of the Federally Qualified Health Center system and is also the state-appointed provider of the required mental and medical health screenings for newly arriving refugees in Pennsylvania's Region 5. 86% of our patients are better served in a language other than English, and 80% of our staff are former refugees from those same population groups. We've collected some great resources for you to share with your communities, and they're available in many languages. They talk about good ways to care for yourself and your family during COVID and other stressful times. Some of the resources that we've made available include managing stress and anxiety during COVID-19. This video talks about ways to reduce stress and improve your mood. It's available in Arabic, Burmese, Karen, Nepali, English, and other languages. The next is promoting refugees' mental health. This is a true story and it's very uplifting. It's shared in Arabic, Swahili, Kinyarwanda, and Burmese. Medline Plus is a collection of trusted online health information that's sponsored by the National Libraries of Medicine and is available in multiple languages. The CDC Toolkit is also a repository of multilingual information about coronavirus. Library of information in different languages that has been collected by the University of Minnesota's NRCRIM project. Like Medline Plus, this includes handouts, videos, and other materials, and it's sorted by different languages. It also includes resources on coping with pandemic-related stress among both children and adults, as well as resources on how to talk to children about the pandemic. These resources are in several languages, including Arabic, Karen, Nepali, Swahili, and many others. Dr. Yun works with this team. Next slide, please. As has been mentioned before, you can find additional information on mental health first aid training on the official mental health first aid website. Our team also has a project website where we share additional information about treatment for post-traumatic stress disorder. You can hear this presentation in English and download copies of our glossaries in mental health terminology. They are in Arabic, Nepali, Saga Karen, and Swahili. And a recording of this webinar will be available on the website soon. Next slide, please. We also want to ensure you know where to refer community members when they need help. As previously mentioned, the United States has a large number of crisis hotlines, including 911 and the National Suicide Prevention Lifeline. All of these hotlines have access to telephone interpreters. Every county in Pennsylvania also has a mental health crisis line that you can call when seeking urgent help for someone. And for a complete list, go to the Pennsylvania Department of Human Services website that is shown here. And every county in Pennsylvania also has a directory of clinics that offer routine mental health care. For community members with Medicaid insurance, each county has a list that can be found through the Health Choices website that is shown here. Next slide, please. Finally, we want to remind you that people have the right to free interpreters for health care, including care for post-traumatic stress disorder or PTSD. This is a federal law. And for example, as we mentioned, if you're in Philadelphia, contact Community Behavioral Health Member Services to request an interpreter for a phone call or an appointment with a mental health provider if you are insured through the Medicaid program. Their telephone number is 1-888-545-2600. Additionally, healthcare providers that do not have easy access to interpreters, such as some of the pharmacies, can also ask to participate in a language access program developed by the Pennsylvania Refugee Health Program to ensure that refugees who have arrived in the U.S. in the past 2 years have access to interpreters when seeking help for mental health needs. And now I'll turn it back to Dr. Kate Yun.
Hi, everybody. I would just like to close out our presentation today by expressing my appreciation to all of the team members who have worked on this project, especially including our language team leaders, our language team members, and the interpreters who have helped us provide this presentation in a variety of languages. Thank you all so much for joining us today. Next slide. For anyone who would like to contact us to learn more, our information is provided here. Thank you again.